Wonderful. And with us today for the Advancing Care Excellence for Caregivers webinar, I have two colleagues, Dr. Beth Hallmark, who is the Director of Simulation at Belmont University, and also Marianne Rizzolo, who is a consultant with the National League for Nursing and was a longtime NLN staff member. As we introduce you to ACE.C, the Advancing Care Excellence for Caregivers, just want to let you know that this is a grant-funded initiative, and we thank the John A. Hartford Foundation and the AARP Foundations for their contributions to this initiative. So just an overview of our 1-hour webinar. We're going to talk about the Advancing Care Excellence series. You'll learn that this is just one population in many populations of our ACE series. We'll also talk about the development of ACE resources using the ACE framework. And then we'll talk about some of these free resources, including the unfolding cases, teaching strategies, and other resources. And then we will talk to you through how you can navigate to these free resources by visiting the nln.org website. We'll also have time for questions at the end, and we welcome your questions via the chat box, which you can access at any time. So with that, I'm going to hand it over to my colleague, Dr. Rizzolo, to talk about the need of ACE.
Hi, everybody, and thanks for joining us today. I don't think I need to spend too much time on this slide because I know that you all know how much the U.S. population is aging. Those over 65, 50 million and growing. They're the people that you see every day in your practice and when you take students to clinical. And most of these folks have one or more chronic diseases, which increases the complexity of their care. And as we all know, nobody stays in the hospital very long these days, so they often come in with some acute condition and are sent home very quickly to their family members or someone who must take over that care. So the response to this need, if you'd go to the next slide for me, thanks so much, Andrea. Here's some of the responses that were made to that our Aging in America problem. You may be familiar with the AARP's report, No Longer Home Alone. The interprofessional family caregiving competencies and domains of preparedness were an initiative that was funded by the Gordon and Betty Moore Foundation. And the Home Alone Alliance was formed. NLN is a member of that alliance. It includes many organizations, and they have all produced a variety of resources that I have to tell you I was not familiar with before we started this project. The next slide kind of gives you an overview of the interprofessional family caregiving competencies that were developed as part of the funding from the Irene Betty Moore Foundation. And as you can see, the various domains that they cover, the nature of family caregiving, the family caregiving experience. I was going to spend more time on, to be honest with you, on these slides and talk some more about this. But these are all resources that are in the additional resources section of ACE on the website. And I think if you are interested in exploring them further, I would direct you to go there. And so that we have more time at the end when we can have some interaction with you, because I'd really like to hear your questions and your ideas about how we can do more for to assist our caregivers. But the preparedness domains that came out of this Betty Moore Foundation funding included the things that caregivers have to struggle with. that may be new to them when someone that they love becomes ill and is now at home. They may have to do household tasks that they never had to do before. Think about the personal care that many patients need. Mobility, getting them in and out of bed to the bathroom without hurting themselves, because most of the time our caregivers are also older and may have their own chronic problems to deal with. Monitoring the health of their loved one. How do I know if they're getting better, if they're getting worse? When should I call the doctor? Coordinating care. Often there are multiple providers that are involved. There may be physical therapists coming to the home. There may be doctor's appointments. There may be nurses coming in. There may be caregivers coming in to provide some of the care. And all that requires a lot of coordination. And then there are the medical and nursing tasks, excuse me, that, we kind of take for granted, but they're all new and some of them are pretty complex. There's the shared decision-making that must happen. And through all of this, they need emotional support and they need to take care of themselves, because we all know how when you're saddled with responsibility day after day after day, perhaps can't get out, all those kind of things make it very difficult and create a lot of strain, caregiver strain. So all of that, all of these things that I've just spoken briefly about are things that kind of guided the direction that we followed in coming up with our ACE cases. So we used the Advancing Care Excellence model, and as I hope most of you have seen some of our previous ACEs cases, we started out with ACE.S. That was our first ACE, Advancing Care Excellence for Seniors. That was funded by the John A. Hartford Foundation. There are 4 cases there. For AZ, MetLife came in and was interested in us developing cases specifically around patients with Alzheimer's disease. And then Michelle Obama came along and urged us all to do more to help our veterans. And so the ACE-V cases were born. Villanova University supplied us with the beginnings of the cases for ACE-D, folks with disabilities. And there you'll find not only an older person with an amputation, but also a young woman who has a stroke in her 20s and then gets pregnant. ACE-P, we all heard your request for pediatric cases because there are so few clinical facilities available, and you were looking for something from pediatrics. We also heard about some of the common issues that need to be addressed, including oral health. And so the Hearst Foundation funded our ACE-P cases. And so now our current one that just went up on the website a week or so ago is ACE-C, Advancing Care Excellence for Caregivers. And we were so fortunate to be funded to develop all these cases. And so they are free for you to use and for you to adapt for your own needs. We supply all the elements of these cases in Word documents so that you can modify them to meet the needs of your own curriculum. And all of them follow the ACEs framework. The ACEs framework was developed initially for our ACE-S, and we've adapted it each time for the new populations that the cases address. But they all have these essential pieces to them. There are essential nursing actions that are included in every one. You need to assess the function and expectations of your clients. You need to coordinate and manage care. You need to use evidence-based knowledge, and that was something that we do with all of our cases to make sure that they are evidence-based. They include the tools that can help both students and nurses to apply that knowledge and to make situational decisions. And then there are the knowledge domains that apply to individualized care, the complexity of care, and the vulnerability during transitions as people move from home to hospital, hospital back to home, to rehab facilities, to all these different transitions, and their healthcare varies in each of them. There are so many opportunities for error and incomplete care that we want to make sure that we're particularly vigilant during those transitions. And although if you just go back, Andrea, I just want to just point out that this not only happens in simulation with our cases, but also in the classroom, in their clinical experiences, in the skills lab. If there are skills that need to be learned, they need to practice them in the skills lab. So it's not a one-shot deal. It happens in many places and in many ways. So that model is what has worked for us in developing all of our cases. But let's go now to the simulation portion. And we decided to use unfolding cases for our simulations. And an unfolding case is a little different from a one-off simulation in that it evolves over time in a manner that's unpredictable to the learner. New situations develop and are revealed with each encounter. And it uses the power of storytelling with the experiential nature of simulation scenarios to get our points across. And unfolding cases are a little different than case studies or single one-off cases in that there is usually a narrow focus on a case study, whereas the unfolding case is much broader. Whereas a case study tends to be faculty driven, and we give a lot of information to the student and then ask for their input. The unfolding cases are student driven. And there's a story that goes along. And we all know that when stories are things we remember, it's nice to, if you think back, how many of you in your teaching tell stories about patients that you've known that have made something come home to you. And so storytelling is a very effective way of transmitting knowledge and helping students to pull it all together. And they can be used in very creative ways. So the elements of an ACE unfolding case, we start off with a first person monologue. And when Beth shows you the, gets into the individual cases a little later on, she'll play some of the monologue for you. And we always encourage people to start off with the monologues. And the monologues don't have to be done in the sim lab. They could be done in the classroom. You could have a great classroom interactive discussion about the elements of the monologue. It could be an online assignment. You could have students click on it, listen to it, read it from the script, or listen to it in the audio file, and then post some questions that you'd like them to respond to. And we do provide, if you look at bullet 3, there is an instructor toolkit to help encourage some creative ideas for that monologue. Each of our unfolding cases has 3 simulation scenarios associated with it. There's a template that gives you all the objectives, the equipment you'll need, an S-bar introduction from the nurse who's going off duty, perhaps. There are chart materials that go along with provider orders, lab results, all that, all the information that you would need to run that scenario. And again, there's an instructor toolkit where we talk about some different innovative ways you might use them. The final piece is something that one of our authors who's been with us from the beginning, Mary Cato, came up with, and it's the finish the story activity. If you take one of our cases and take it through the monologue and the 3 simulations, Mary Cato said to us, well, you know, wouldn't it be great if students could finish the story of the case that we've created? They've seen this person at least three times. What do they think might happen? And when she piloted that the first time with her students, the students said, oh, please don't make me write another paper. So Mary said, no, you don't have to write a paper. You can do anything you want. And so her students wrote songs. They wrote poems. Some of them wrote nurses' notes. They came up with a visit that happened after that third scenario and wrote some very touching creative ways of finishing the story. And what we discovered from that was that it really helped to reassure us that the students had gotten the message. They really got what we wanted them to get from all of the pieces that make up the unfolding case. And so how do we approach an unfolding case? Well, we already told you about some of the evidence that we collected from the family caregiver domains and competencies, from the reports that we read, but we could only do 3 cases. And so we wanted to be sure that we included in those 3 cases the most common things that our caregivers struggled with. And Beth actually made a table that as we talked about this and read through interviews that were conducted with caregivers during the summer of 2018, we recorded them and listened to them and then discussed it with our case authors. We made a table where we put in the various themes that we wanted to be sure we included, and then we spread them across the 3 cases. So some of the themes that emerged were jumping in, and that was all of a sudden, you know, you're thrust into a situation and you're feeling so unprepared. And then there was trying to seek information, particularly about how their loved one, the person that they were caring for, what was likely to happen over time. You know, were they going to die? You know, how might that happen? So there was a lot of information seeking that they talked about. They talked a lot about needing help with basic caregiving skills. They talked about being respected by healthcare professionals. I mean, they're with this person all day long, every day. And yet, in some cases, they didn't feel respected. And then they talked, of course, about the constant stress and caregiver strain, and sometimes guilt, because when we're under strain, sometimes we snap at people, and then we feel guilty. And it's really very tough. They also talked, however, about the positive aspects of caregiving, and talk about a little more about that later. And what we did was, as we created the cases, we tried to put in place, you know, divide all those various themes over the 3 cases. And this is we wanted to, before Beth gets into talking about the specifics of each case, we wanted to be sure to recognize the folks that worked with us to make this happen. Our authors were Mary Cato. As I mentioned, Mary's been with us from the ACE.C cases from the very beginning, and I think she's done one of almost every case that we've done. And so she's our resident expert. Margie Malloy at Duke was having a caregiver experience of her own, and so she brought a very unique aspect to the development of our cases. And then we were extremely lucky to have Catherine Sexton, who was our subject matter expert and sat in on all of our conference calls as we developed these cases to give us the expertise, because we wanted to make sure these were evidence-based. She brought in that evidence for us. And then we also want to thank our pilot schools, because once we develop a case, we want to make sure that that it's correct, that it includes the most current information geographically across our country. Because in some cases, when we pilot, we find out that this drug isn't used here anymore, or this treatment is not particularly something that we do. And we want to make them as generic as we possibly can and as universal as we possibly can. So we always include various programs, associate degree, baccalaureate degree. They're all pre-licensure students, but in various types of programs. And we look for the geographic diversity across the country. And they very graciously took the time to assemble their students, run the scenarios, and give us so much great feedback that we could use to tweak them and get them ready for you. We know that you're going to, again, tweak them yourselves, but we want to give you the basics that we know are correct. So, and with that, I'm going to turn it over to Beth so that she can tell you more about each individual case.
Thank you, Marianne and Andrea. Welcome, and I'm excited to tell you about these cases. I have thoroughly enjoyed getting to be a part of this project. It's been very meaningful, both personally and professionally. So the three cases that we have, as you can see, are all caregiver related. And I wanted to remind you of that as you're thinking about these and as we're talking about the cases. They're unfolding, and the first one is related to a mother and a daughter caregiver of her elderly mother, and we'll talk more about that in just a minute. And then a caregiver, Eileen, who is caring for her friend, Angela. And then a husband and wife team, Phil and Lois Gardner. And I want you again to remember that this is a caregiver focus, and these are unfolding, and I'm going to talk specifically about these as we move on. Again, if you want to move to the next slide, Andrea. Thank you. So these are different, and it's really important that you consider how different they are as you're applying these to your program of study. If you're familiar with the A series, they're a little bit different in terms of what you've experienced in the past. The students will be really focusing on the caregiver. We actually have a statement in each of the charts and the documents to remind you of that. When we piloted these and the schools piloted them, both the faculty and the students really had trouble focusing on that. They want to go back to that skills. They wanted the students to really think about the skills and why are the skills not included in this. And it's important.
Just a moment.
Oh, sorry. The students very often wanted to do more skills. They wanted to think about what skills, as well as the faculty did. They wanted to think about the skills. So as you move through these and we talk about them, think again about the caregiver. Next, I'm going to play for you a little bit of the monologue, or I guess Andrea is going to play for you a little bit of the monologue and let you hear from our first pair, or Bridget, talking about caring for her mother.
Hi, I'm Bridget Nelson Hardy. My mom, Peggy Nelson, fell at home yesterday and broke her hip. I am anticipating a tough few days ahead, especially because recently I started noticing that she was getting a little more forgetful at home. For example, she was always on the ball with sending birthday cards to everyone in the family, even her nieces and nephews who live far away. But now it seems like she doesn't even remember all of their names. She tries to hide it when I ask her, but I can tell. Besides that, I have noticed her mail was stuffed into a drawer in her kitchen, and I'm afraid that she's going to miss paying a bill or something. Just when you think life is going to get easier, things happen. I've been married for 29 years to a wonderful man. His name is Tom, and he works for a technology company close to home. He is so helpful with checking in on my mother whenever he gets the chance. She has him on speed dial when she needs something repaired. Tom and I are finally empty nesters. The last of our 3 kids just graduated from college, and all 3 are moving on with their lives. Our oldest son and his wife are expecting our first grandchild in 2 months or so. Tom and I are so excited, but they live out of state, and now I'm not sure how often we'll be able to visit because of my mom's condition.
Great. Thank you, Andrea.
Hi.
So that was part of the monologue from the Bridget Nelson Hardy and Peggy Nelson case. And there's 3 scenarios, as Marianne indicated earlier, in each of the unfolding cases. And you can see the storytelling aspect comes out already in the monologue. And as I'm talking about these, I want you to think also about the caregiver competencies that you may have, that Marianne reviewed for you, and think about how the nursing students need to be prepared to help the caregivers that they will be working with their patients, and how those are important. So the first scenario that we see with Bridget and her mother, Peggy, is actually in the acute care setting. Peggy has fallen at home. She has a left hip fracture, and she's had an open reduction in internal fixation. Bridget's at the bedside, and she shows concern that her mother is having pain, and she also is worried about using the PCA pump and her forgetfulness. The first simulation actually has objectives related to that. So Marianne also talked about earlier about the evidence and how important it is that we use evidence. And several times in these cases, we use evidence-based tools and allow your students to use those with the simulations. And the objectives of this first simulation really talk about how the student can help elicit baseline information regarding mental status using those standardized tools. And then how we can help the caregiver in assessing how to identify the mother when she's in pain. And then beginning to think about discharge. As we know, discharge starts in the very beginning when they're admitted. The second scenario is after the patient has been transferred, or Peggy's been transferred actually to a rehab facility, and the mother is tearful and asks for the daughter, Bridget, to not put her into a nursing home. And you can see there that caregiver strain and the guilt that comes with caregiving. And part of the objectives here are for the student to actually assess the caregiver to be prepared to take care of her mother when she does move or transition to another area. And also, we tried to include some interprofessional competencies so that the occupational therapist could be involved here, and they make some recommendations for the home. And then discuss the importance again of caring for herself, the caregiver herself. And then after the next simulation scenario is where 6 months have passed and they're back in the home, and Peggy is in her home, and Bridget is really concerned for that. She elicits some care from her community, from her church, and they talk about how difficult that is. And the objectives of this scenario are very similar in terms of assessing caregiver strain with a reliable tool, and then thinking about the emotional and economic impact that this can have. Peggy only has limited resources, and then how does Bridget have to come in and help with that? And then identify some long-term caregiving. So that's the first scenario, or the first case. Let's move on to Eileen. She's the next case. And Eileen is Angela Foster is a 60-year-old who has been diagnosed with breast cancer. She has a mastectomy, and she gets needing radiation and chemotherapy. She's divorced. She does have 2 sons, but they don't live nearby. And she has a friend who she taught with, Eileen, who is her friend who's going to help her with her post-op care. And Eileen has agreed to that, but Eileen also has caregiver strain. She has 2 daughters, a set of twins that are grown, and she has to babysit for her granddaughter on a pretty frequent basis initially, and then that progresses throughout the scenario or throughout the case. The first scenario is again in the acute care setting where Angela has had her mastectomy, and Eileen's having to learn how to take care of those surgical drains. We did include some tasks within these simulations and cases so that we would make sure that it was realistic, so that the students did understand that there would be some care, but we also wanted the nursing student to see that the caregiver is going to have to learn how to do those care those care tasks at home. And some of those are nursing tasks that you might think of, but we need to make sure that they understand that family and friends are going to have to learn how to do those at home often. The objectives for that first scenario are just that she can assess the wound and that she can, again, be able to take care. And we want the student to assess that using that reliable tool. And this second scenario is in the cancer center after the mastectomy, and Angela has come in for her radio therapy and her measurements for that. And Angela, unfortunately, has fallen and sprained her ankle, so she can't go in to do those herself. And her friend Eileen has to help with that again. Angela needs help with her cooking and her daily tasks at home. And again, that goes back to those caregiver tasks that we talked about in the very beginning. Objectives of this part of the case are for us to, again, use a standardized tool to assess the caregiver competencies, and then provide provide tools to help with things like transportation and meals and community resources for those things. The third scenario in this Eileen and Angela case is at the care center where she's getting chemotherapy. And at this time, Eileen's really beginning to see the caregiver strain. Her daughter needs more help from her with babysitting, and it's becoming much more difficult for her to be able to do that. However, Angela still is relying heavily on her. Angela is also beginning to have some nausea, and we actually introduce some alternative therapies here related to cannabis, and they ask about cannabis and what that would look like. So we want to think about caregiver burden during this time also. The third and final case is related to Phil and Lois Gardner. Phil is a 74-year-old retired firefighter, and he's married to Lois, and they've been married for 25 years. This is a second marriage for them, and Phil has 2 adult children from a previous marriage. Lois has had a history of having a MI about 20 years ago and has COPD and congestive heart failure. Phil has noticed some memory loss over the last few years, and he's been managing her medical care. Again, there's 3 portions to this case. The first is in the acute care setting where Lois is hospitalized for pneumonia, and Phil begins to have to think about doing more care that he's been doing in the house. He has to think about those ADLs and her helping her with her cognitive tasks and assessing those cognitive tasks. She also needs some help with mobility. And she also Phil needs to be able to assess her respiratory status. So those are some of our objectives in terms of helping Phil understand what he needs to do. And then scenario 2 is in the home about 6 months later, and Lois has actually been diagnosed with dementia. And Phil has had to go take her into the emergency room for chest pain. And she is seeming to have some decrease in her medical condition and her cognitive condition. Phil does begin to express some concerns about those household duties again. And our objectives are to help him, the nursing student, to help him make sure the patient is safe in the home. They use standardized tools again to look at caregiver strain. And then the final scenario is actually after Lois passes away, and she has actually, Phil has actually moved into a retirement type home, and he begins to process some of the things that had happened as Lois actually dies while he is away from the home. And we integrate the guilt of the caregiver in there, and the blended family, and the fact that there's a male caregiver in this scenario. So you can see these scenarios are very different in terms of the type of caregivers that are there. We wanted to make sure that we included 3 different types of caregivers and 3 different situations. Marianne or Andrea, does anybody have anything to add before I move on to how to integrate?
No, I think you've covered it pretty well, Beth.
Great. So the next slide is talking about integrating your ACEs resources into your curricula. First thing I would remind you of is some of the things that Andrea is going to go over later, some of the teaching strategies that you can apply. But think about when Marianne earlier was introducing how we develop these cases and how you may integrate them into your curriculum. First of all, think about the monologue and how you might be able to use that, especially now in the time that we are trying to figure out how we are going to move our clinical to an online or to a virtual place. We are actually considering using these case studies with a live collaborate or Zoom type situation where we can actually see some interaction and the student can respond as we present these cases to the students. You could have them again do the monologue prior or do some of the pre-work prior and then come and have some really rich discussion. And when you think about interactive cases, these are very interactive. You can show you can see how the student could actually say, well, I might do this or I may do that, or if I taught the student, the caregiver this, how would they respond, or what would happen possibly when Lois dies in the end, and really integrate some of this virtually. The NLM website does have a link to a webinar that Marianne and Sue and I did, and Andrea and I did earlier in, I guess it was last week, about how to integrate some simulations and some virtual products into your curriculum in terms of this COVID-19 crisis that we're facing right now, and doing SIM remotely. There are lots of ways to do that, and we do have some resources for you on the website, and Andrea is going to show you those later. I am going to turn it over to Andrea now, and she is going to introduce some teaching strategies that are part of the product.
Great, thank you, Dr. Hallmark. So we're very fortunate that with the Advancing Care Excellence for Caregivers population that we were able to add 5 new teaching strategies. This is inclusive of a total of 48 teaching strategies in the Advancing Care Excellence series. So this is a wonderful resource of different materials that you can use in your classroom. You can use it online. And I just wanted to talk a little bit about the 5 that we developed for caregivers. The first one is about family-centered communication strategies and family caregiving. As you can imagine, when we conducted our caregiving interviews, one of the themes was some additional challenges with whatever family dynamic, even if it was a perfect family dynamic before there was a caregiving need, that it can add some tension or some difficulties when you add caregiving to the mix. And so based on those interviews, we decided to have an expert out at the University of California, Davis in the Family Caregiving Institute write about family-centered communication strategies. This particular teaching strategy also includes a case study, and so that's something that you could definitely assign to your students and then do a debrief or discussion via a discussion board or chat or via something like this, like a Zoom meeting. The next teaching strategy idea that we had was about the positive experience of family caregiving. And this kind of came out of some of the negativity that tends to trend when we talk about caregiving, that there's a lot of strain, that there's a lot of burden. And we were kind of wondering, you know, with every interview, even though people were opening up themselves and talking about some of the hardest difficulties in their lives, everyone that we interviewed was able to highlight something positive that came out of it. And so we really felt that it was important that we be able to share that aspect of family caregiving, especially with nursing students, to make sure that, you know, they know that there is something that maybe they can connect with the caregiver on, and to help them reframe when there are some challenges. This particular teaching strategy has a student reflection activity for them to explore their own thoughts and biases about the caregiving experience. It also links to a number of different videos, which is a great thing that you can assign students to do. Watch the videos, online, and then again, discuss, debrief afterward. The third teaching strategy focus on millennials and providing care for older adults. One of the trends that we found actually from the Home Alone Alliance, from that No Longer Alone report that AARP put out, is that there's increasing number of millennials who are caregiving. And so we just wanted to highlight the millennial experience, especially since we weren't able to highlight that in any of our 3 unfolding cases. This teaching strategy on millennials has a sample learning activity that includes a concept map. So if that's something that you'd be interested in doing with your students, definitely the supporting millennials teaching strategy would be a good one to explore. The fourth teaching strategy talks about technology support for caregivers. There are so many different apps and different devices that can potentially assist a caregiver in helping ease the way in their caregiving responsibilities. We were very fortunate. This teaching strategy was actually born out of a Nursing Education Perspectives article. NEP is the NLN Research Journal, and in our Emerging Technologies column, there was one about a year ago about technology support, and we were so grateful that the author of that, Dr. Karen Frith, agreed to write a teaching strategy about it. So this explores technology support and also healthcare policy. So this has some different learning activities around policy work and other research initiatives. So if you have a class that's more geared toward that, this could be a great teaching strategy as well. And then finally, we have a teaching strategy that's devoted to a case study of Emma, who is using some technology support in caregiving as well. And so again, if you're interested in kind of a case study for your class, this is one that has a fairly expansive case study that you could utilize. So these are our 5 AC teaching strategies. All of our teaching strategies have learning objectives listed. There's learner pre-work, there's suggested learning activities, and there's also a number of resources online that help bolster and support the teaching strategy. So definitely consider looking at those in addition to the 3 unfolding cases that Dr. Hallmark talked about. And so with that, I'm going to take us through how we can navigate to all of these wonderful resources that we've talked about in the first about 45 minutes of our webinar. As I do this, I do encourage you, if you're listening in and you have a question, after I go through the navigation piece, we will answer your question. So feel free to chat that at us, and we'll be happy to answer your question. So you may be wondering, how do I get all these wonderful resources? Hopefully something has piqued your interest that we've spoken about. And really the best way to do it is to go to the NLN website, that's nln.org, and there's always an NLN logo in the top left corner. And there's always a different banner that kind of flips around. Right here you see that there's the NLN Education Summit. But to the right of the NLN logo, we have our tagline, the voice of nursing education. Then we have this drop down that's called Quick Links. If you click on Quick Links, here's where you'll see about over 100 quick links. However, we're very fortunate that the ACE series is right at the top because it is in alphabetical order. And so you can navigate right here to ACE.C for caregivers, and that will take you to the ACE.C landing page. All the ACE.C pages have these 3 photos at the top, and also will have the ACE.C logo. Wherever you are on the ACE.C web pages, you can always click on the logo and it will return you right to this ACE.C landing page. Here you'll see we have unfolding cases, teaching strategies, our framework, and the additional resources in this table here. So if we click on Unfolding Cases, this is where it will have our Unfolding Cases page. It'll give you a bit of information, just an overview of unfolding cases. And then again, at the bottom, we have our 3 cases in this table. For purposes of going through this, we'll click on the Bridget and Peggy case. And that will take us to a brand new page devoted to Bridget and Peggy. And this will give you an overview of the case, overview of the simulation scenarios 1, 2, and 3, the case author, but also what it has is at the very top, there's something called an accordion button, and that's a circle with a plus sign, and it says download all files for this unfolding case. You'll want to click on that, and what will happen is at the top, it will tell you how many files for that case. So for Bridget and Peggy, there are 11 different files. And so this is the easiest way for you to get access to all those files and to download them. It has different instructions based on whether you're using a PC or a Mac, but basically all of these items are hyperlinked and they're free to download. All you do is you click on it, and it will download. Here's just an example of one of the downloads. So if you click on the simulation template 1, you'll come up in a Microsoft Office document, and this is the template. It's something that you can go in and you can edit. We have it as a Word document precisely so that you can make it easier or more challenging, or change things a little bit to make it resonate best with your students. So once you've gotten all of your unfolding cases that you want, you click on the logo again, you'll get back to your home page, and then let's next go to teaching strategies. Here we'll have our 5 teaching strategies that I just spoke about. Let's click on the first one, the family-centered communication strategies. With this, you'll see a number of these accordion buttons again. We'll have all the files, objectives, the pre-work, learning activities, suggested reading, etc. Here, while you're welcome to just click on each one individually, because there are multiple, you're welcome to also click on this expand all. Probably the easiest thing to do. Here you'll be able to download it as a PDF. Every teaching strategy, ACE, or any of the other populations, you always have the option to download the entire thing as a PDF. But it also unfolds or unveils learning objectives, the pre-work and such. And you can also collapse it back and then click on the logo to get back to your home page. The ACE framework, I'm not going to demonstrate that just because that is the graphic that Dr. Rizzolo showed you. And instead, I'm going to take time to just click on this additional resources tab. Here you will see we have interprofessional caregiving competencies and the domains that we discussed at the very beginning of the webinar. These are PDFs directly from the University of California, Davis. We also have a number of different documents as part of the NLN's membership in the Home Alone Alliance. One of the things that we do want to draw your attention to is AARP does have a how-to video series, which is all professionally done. About at least half of them also are in Spanish as well. And they focus on different caregiving tasks. So that is something that you can definitely be interested in exploring. The final thing that I want to talk about is if you go back to the home page for the NLN, is how to get to our Coronavirus Resource Center. And so we did mention that we had a town hall last week where we talked a little bit more in depth exclusively on online teaching and learning, how you can adapt and use materials online during this time. So the easiest way to do that is, again, to go to our trusty quick links. We're again pre-fortunate. Coronavirus is almost toward the very top. You can go to the Coronavirus Resource Center, click there, and then what you'll see is some different resources, including the recording of the town hall from last week. I actually just added some additional resources to this page this morning. So this is a great resource, and we just wanted to make sure that you knew how to get to it. So with that, that's the ins and outs of how to navigate the NLN website. And so we'll now open it up for some questions. It looks like we do have a question from Kim, who has a question about vSim for learning, vSim for nursing. How has virtual simulation for students that they could utilize? I'm wondering if Beth or Mary Ann wanted to tackle that question from Kim.
vSim is a product of Wolters Kluwer that was developed with the NLN and Laerdal, and it is a commercial product. So you would need to contact them to see, you know, what the pricing situation is now, if they're offering any free previews or whatever. But that is a commercial product. But if you go to our list of resources that Andrea just mentioned, there are a lot of free resources that are out there that, you know, pre-recorded simulations with ideas about how you could use them.
Yeah, this is Beth. I was just going to echo that. There's some great resources on there that we developed after the town hall, and I recommend you going there.
Other questions? Or ideas? Any of you want to share some of the ideas you have for coping at this trying time?
Mm-hmm.
Rose? Can we unmute Rose, or?
Rose is unmuted if she'd like to
Yes.
say something. Sure.
Okay. So what I have been doing is I've actually taken many of these simulation scenarios designed by the NLN, and I've actually read through all of them. And if you open up every single, whether it's the link, you know, or the topic, it will really give you a thorough idea of where you want your nursing care to go. So what I did was I created a pre-simulation assignment first, and then I embedded the link. And then after that, I did some questions based on the actual, you know, interaction with the patient. And also, you know, I also have the students critique. So for instance, when they're looking at the video, if there's something that they could add to it, I would ask that question. And, you know, I use Pearls for debriefing. So using some of the Pearls framework, that also always helps me design my questions. You can also, if you're using team steps, you can design a lot of the questions based on team steps. So if, again, you look at all the material, watch the video, and then see, looking at team steps, see if these competencies can be seen in the video. Does that make sense, what I'm saying?
Mm-hmm. Thanks for sharing that.
I just find this very helpful. It's extremely useful. The fact that it's free and available helps a lot of us because I work at a state school and we have very little money. And we have used this actually since this whole COVID started about 2 weeks ago. We've used just about everything that NLN had to offer.
That's great.
You know, I was thinking as Beth was talking about the cases, I mean, I could just envision you having a Zoom meeting like this with your students, and you could be one of those caregivers. You could be Bridget, you know, and they could be talking with you about some of your concerns and so forth, and implementing some of the tools, caregiver strain index, you know. So even though you may not have a simulation videotaped already, you know, to start with, although there are plenty online on YouTube and whatever, where you could show a piece and stop it and have your discussion. And, you know, Zoom, if you don't already have some kind of platform like this available at your school, Zoom has a free version.
Got to be quick with it, but it is free.
Yeah, it's
you can have some short Zoom meetings.
yes. WebEx, there's
Shout out for WebEx, yeah.
plenty of platforms you can use.
Some people have been using Google Hangout or Google, is that what it's called? You have to have a Gmail address, but I think, you know, that's an easy fix. So that's another idea too.
That or Skype or
Mm-hmm.
with Zoom. I'm not as familiar with the free Zoom. I think free Zoom ends at 40 minutes, if I recall, but I don't remember the number. I don't know if either of you know. That was a question.
I think if it depends on how many people you have, how many minutes you're allowed. I think it's longer if there's just two, you know, people interacting, and if as you add people, I think the amount of time you have goes down.
Yeah, and Zoom had said they were going to offer some discounted or free things, so you might look into that during this time too.
And, you know, I would, if you've seen something at a conference, exhibit hall or something, some products, I would urge you to contact those vendors and see, I mean, many of them are being very generous with free trials and stuff, because it's to their advantage to let you see their product, because then you may purchase it after this, hopefully after this crisis subsides. So I've heard that there are, you know, some really good deals out there right now, and some of them are free.
It sounds like we've got quite a few comments, which is great. I know we had Laura is using clinical groups are meeting on Google Weekly. That's definitely an option.
I see the comment from a student, and I would urge you, if we have any other students on as well, to keep in close contact with your school and your faculty. They will be in touch with your Board of Nursing to make sure that you're able to meet requirements to, given the fact that the many campuses are closed.
Well, thank you all for your chats and your participation. I did want to give just a final shout out and deep thanks to our funders, both the John A. Hartford Foundation and the AARP Foundation. The recording of this will be put on the additional resources section of the ACE website by the end of this week. So if you're interested in sharing it with your colleagues, or if you'd like to watch it again, that will be available to you. So other than that, I see we're at our 1 hour. So thank you to our two presenters, Dr. Hallmark and Dr. Rizzolo. And I hope that everyone on our webinar continues to be safe and healthy during this time. Thank you so much.
Thank you, Andrea.
Bye.